Hey guys, it's Angie Martinez. We have Dr. Jan Katsnelson in the building. He is the CEO of USA Fibroid Centers.
Hello, Angie. How are you?
I'm good. How you doing?
Very good. Thank you very much for inviting me.
No, it's my pleasure to have you here. We actually mentioned that you were coming today, and people sent in some questions because people are very interested in this subject today.
Fantastic.
So, and honestly, I think sometimes people don't even know how to, maybe they hear about it. They don't, maybe somebody in their family has been affected by fibroids and so I guess I got a little bit of mix of people who had different questions. So hopefully you'll answer some of those today.
Happy to answer.
What is the number one question you are asked about fibroids?
Number one question is how often that happens.
Mm-hmm.
And another one, why I was recommended hysterectomy. That's probably the most common questions.
And what are the answers?
Fibroid disease is a very common condition. 80% of black women and 70% of white women by age of 50 will develop fibroid disease.
Wow.
Which is prolonged
That's
heavy
a
menstrual
big
period.
number.
It's huge.
Yeah.
It's almost everyone.
Mm-hmm.
And most women end up with a hysterectomy. 1 out of 3 women gets hysterectomy. That's terrible.
Mm-hmm.
And when they ask me why they get this recommendation, well, the answer is interesting. In medicine, when we have multiple treatment choices, most likely the choice will depend on a physician that you will ask. Depends what physician does. So if woman goes to gynecologists do myomectomy and hysterectomy, she will get hysterectomy advice. If she will come to interventional radiologist who does percutaneous minimal invasive uterine fibroid embolization, which spares the uterus and women can have a normal pregnancy, that will have uterine fibroid embolization. And
what is that? Just speak to me like a third grader. What is fibroid embolization?
Okay, so I'll tell you what is fibroid.
Yes.
Fibroid is a growth. It's basically a benign tumor. It's something growing in the uterus that irritates the uterus and creates the symptoms. It's either prolonged heavy menstrual period, bleeding. During the period, long period, and between period, bleeding. It's also because it's a mass. Can be 1, can be 20, can be as big as a grapefruit. This mass can compress and press on different organs, like a bladder, create a small bladder, symptoms. Or that women need to run to urinate every 15, 30 minutes. Or it can compress on the bowel, create constipation.
Is it sometimes it could be there and you don't even have any symptoms?
Sometimes.
Yeah.
Sometimes it can be like a bloating or baby bump. But most often, eventually, it becomes symptomatic. One of the terrible, terrible symptoms when women learn about fibroids after they lose baby, miscarriages. Because if something grows in the uterus, it competes with the baby for blood and space. Okay? So basically, something that's not needed grows. It's not cancer, but it's not good. So the treatments are basically 3 main treatments. 2 treatments are done by gynecologists, and they're very, very common. One is myomectomy, when it's basically C-section. The uterus is open like a steak.
Wow.
And just scrape. The fibroids are scraped. Not nice. And it's not nice, and in 50% in 2-3 years they'll come back. And many women have 2, 3, 4 myomectomies. And it's in the hospital, it's recovery, it's pain, it's a problematic treatment. The typical course of event when women age 35, 40 start get recommendation for hysterectomy. Kind of, you're done with the babies, maybe we can just remove all of it. In my opinion, it's a terrible recommendation. Why? Because, first of all, women might want to have a babies, and it's not good to remove it. Second, that's what defines women. And third, nobody talks about this. Removal of uterus creates a bunch of other problems. For example, uterus is pretty firm structure in the bottom of the belly. So if it's removed, everything falls down. Nothing holds. So it creates incontinence. urinary poop. I mean, that's not good.
Yeah.
Also, if during the orgasm there's a contraction of the uterus, what do you think happens with the orgasm if there's no uterus?
I have no idea.
Okay, so that's it's not the same.
I bet.
It's not the same, and nobody talks.
Nobody
Also,
talks. I've never even thought about that.
All right, so
That's why you're here.
I was told, I was told this, so that's it kind of makes sense.
Mm-hmm.
Also, a bunch of other complications.
Mm-hmm.
It's injuries to other organs, and it's not good. It's not good at all. Consider alternative. Uterine Fibroid Embolization is a treatment that was around for 25, almost 30 years, FDA approved.
Mm-hmm.
But because it's done by obscure specialty, women never get to this. So what is this? It's a catheter-based procedure. There's a heart surgery and there's a catheter, like stent in the heart.
Mm-hmm.
So it's a catheter that we put in the wrist or groin. 1 millimeter, 1.5 millimeter in diameter. We push this catheter through the blood vessels towards the origin of the arteries that feed the uterus, fibroids. And we clog them. And because we clog those arteries, the blood supply to fibroids is ceased, and they just shrink, die, basically get absorbed by the body. Think like a grass.
Like what?
Like a grass.
Oh, grass. Uh-huh.
So if you stop watering the grass, it will die.
Yeah.
Exactly the same thing.
Wow.
Procedure takes 20, 30, 40 minutes.
Oh, wow. So there's no recovery time?
Hour, 2 hours later, after the needle hole heals, hour or 2 hours, a woman can go home. 2-3 days later, go to work.
Wow.
In the office, no need for hospitalization. Covered by insurance.
It is covered by insurance.
Managed Medicaid's cover this.
So why would they jump to harsher treatments?
Because they get recommendations. Because they don't know. There's even worse thing. They suffer 20, 30 years. They waste their lives. So the fibroid disease is not just medical condition. It's a physical troubles, like literally troubles that come and goes every month or sometimes all the time. It's a mental problem. I mean, you will not be in the right place if someone, I assume, right, if women bleeds all the time and suffer and anemia and weak and pain.
No, I have friends who've gone through this.
It's terrible.
It was terrible. Yeah,
it's a social problem too.
Yeah.
No normal. You cannot wear white. You cannot go outside. Every time women say like you watch me, I'll watch you, because they're afraid of bleeding constantly. Cannot sit down. Cannot do it. And it's also even. It's a family problem. They have miscarriages. They cannot have baby. I mean, it's a big, big problem, and it's economic as well.
How come? How does race play a part? Because you mentioned 80% of Black women have suffered from fibroids, and
70% of whites.
Wow.
But there's a bigger discrepancy, right? It seems 70-80% seems close, but there's big differences. So. In the Black women, unfortunately, disease starts earlier. So in the ages of in 20s, right, 20, 25, about 26, 27% of Black women and 7% whites will have disease. By age of 35, 60% of Black women, 30% of whites will have it.
Why is that?
Genetics. Also, we know that symptoms are harsher in Black women and they bleed more. So it's unfortunate. And many times women just don't understand that it's disease. Like imagine if almost everyone has it, is almost everyone in the family had it. If almost everyone has it, how do you know it's not norm?
Got it.
So, and
you just think it's something you're supposed to suffer through without.
Suck it up, kind of move on and just don't complain. And an alternative was for hundreds of years, it was hysterectomy. So no choice. So it's a lack of awareness. Imagine you have a headache and the treatments are do nothing or Tylenol or cold compress or removal of the head. And doctors will tell you need to remove your head, right? And don't mention, and that's what, so women suffer for 20, 30 years, waste their life, get blood transfusion, iron transfusion, cannot function, cannot go to work, cannot make, if you go, most people, it's hourly pay, right? They cannot go to work, they don't make money.
Yeah.
So it's all this terrible, and they have no idea that they can come and have a procedure in the office, 2 hours later be at home, and be done with this.
And what is the success rate? Does it work every time?
It's a great question.
Yeah.
Every time, 96%, 95, 96%. So we publishing right now a big series. It will be published hopefully soon that we've done. And we've seen 95, 96% for improvement for bleeding, for pain, for sexual satisfaction, and for many things. Important thing, we've seen a bunch of babies born after this, and there were studies that you decrease blood supply to the uterus. Is it still enough blood for the baby? Yes, actually more babies after UFE than without UFE, and definitely no babies after hysterectomy.
No.
So very, very good results. Also, we have at USA Clinics, we have 170 almost locations in 30 states. Not all of them, but many do the fibroid treatments. And we've seen that recurrence of the treatment is maybe, recurrent treatments needed maybe 1.2%, 1%. So it's a very, 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 very good treatment.
So even if you are the 4% that it doesn't work, you can still do another treatment.
You can do another,
yeah.
but yes. So, it's almost perfect. That's medicine.
Yeah.
Nothing 100%.
Yes. What about if you've already done something else? What if you have already had a hysterectomy or what's the other thing?
Myomectomy.
Myomectomy.
So we have patients that come after myomectomy. It's a little messed up, but we're happy to able to help them.
Okay.
But after hysterectomy, everything is gone. Everything is gone.
Yeah.
That's basically the mission. It's nobody needs to suffer. So if girl or women have the fibroid disease, they should not be afraid or scared that their life will be ruined because of bad luck. They need to know that they can use this uterine fibroid embolization, UFE procedure, to normalize their life and completely fix it. Think about teeth, right? Many people, pretty much no one is born with beautiful teeth, right? Like if you'll see good French movie, you will not see beautiful teeth. But in America, everyone has beautiful teeth. And Medicaid covers because we think a beautiful smile will improve everyone's chances and make people happy. And it's covered, right? But whether you have a straight or crooked teeth, you'll be able to chew, doesn't matter what. But it's covered, and everyone knows, nobody afraid. So what we're trying to do at USA Fibroid Centers to make sure that every woman never afraid of fibroid disease. It's very common, but when it becomes symptomatic, when it limits their life, when it creates a problem, they need to know it's not a big deal. They can have a quick procedure, uterine fibroid embolization, and that's it, and go on with normal life. So the goal is for every woman to have the best version of her life and not to suffer like today.
Yeah. So when is what is the first step to if somebody feels like this might be or they're curious about if this is something they're ready to do, what do they do?
Great question.
Yeah.
The good news, the typical study that can find out whether you have or not this disease is ultrasound. Ultrasound is very common.
And doesn't hurt. Ultrasound
doesn't hurt. It's not X-ray. It's just ultrasound.
Because people are, sometimes parents or grandparents, or sometimes people are afraid of the doctor, or so they're living with pain or living with discomfort unnecessarily. That's why I kind of harp on is there pain? What is it? What is the process?
So transvaginal or transabdominal ultrasound, they do for pregnant women, right? Every GYN office has an ultrasound, and many other doctors have it. 5-10 minutes, you'll see, it's a tumor, right? It's something that's growing. They will see it, yes or no. In rare cases, we ask patients to have MRI. Okay, it takes a little longer, but also no radiation. It's a very, very easy study that can be done of pelvis. And then we'll be able to see the fibroid disease. There's a law in Florida that enables free fibroid screening, no charge, with ultrasound for every woman.
Wow.
In Florida.
Not here? No.
Not yet.
No.
Not. But
insurance probably covers it for most.
Yes,
yeah?
but even if people, so it's for insurance to cover, free, no copay, no nothing. There's hopefully there will be a law in the United States through Congress that, senators and Congress, men and women, try to pass the law. It's Fibroid Research and Education Act. For the last probably 15 years.
Wow.
Still didn't pass. The NIH, right, National Institute of Health, they have grants, billions for research. Grants for fibroids, $80 million. It's like micro drop in the bucket. 80% of women suffer.
Wow.
Hundreds of thousands of pregnancy get disrupted from this. We should care more.
Yeah.
Happy wife, happy life, happy woman is really what we society need to focus.
I love that. I agree. Well, what is the first step? Is there a place you could go? Is there a website? Where can we get people literature information?
It's usafibroidcenters.com.
Okay.
usafibroidcenters.com.
Okay.
They can go schedule online.
Wonderful.
And there's a phone number to call. We have many locations. Like in New York, we have, I think, 39 locations in the New York metro area. And so it's the process is very easy.
Okay.
When they come in our offices, we can do ultrasound, we can do endometrial biopsy, pap smear, everything they need to make sure they're in a good shape to rule out any other reason for bleeding or any other symptoms.
Got it.
Blood work and the procedure, we get pre-approval for procedure that can be scheduled in 2 to 4 weeks. And during the procedure, they come. Procedure takes between 20, 30, 60 minutes. Hour to 2 hours later, a woman can go home. And 2 or 3 days usually go back to work. So the recovery, during the procedure, there's no pain. Right? It's light anesthesia, like when they do gastroscopy or some very light anesthesia, so they don't feel it. After procedure, they can feel cramps, right? Because we basically make this tumor starving, so it's a little discomfort. Some women feel it more, some women feel it less. And we prescribe pain medication and explain how to deal with this. And they can always call us. Usually it's 2, 3, 4 days. And some people, if you need to work, they go to work in 2 days. If you have a luxury to stay at home 4 or 5 days, you stay more. But that's supposed to take care of the problems. Bleeding, pain, suffering, go back to normal life. Anemia goes away. So if women bleeds all the time, they become anemic. It's interesting. We had a woman that came with a hemoglobin 4. It's like
it's like
black
I know
woman
what that
that's
is.
a white. That's and it's actually came to one of our Philadelphia office.
I don't know how that person was alive, but
don't know either.
Yeah,
I don't know.
That's like losing maybe 85% of your blood. Is that right? Maybe more.
70%.
Okay, 70%. It'd be like 70% of the blood in your body is gone.
Yes,
and
it's just you basically have mostly water than the blood.
Yeah,
it's
wow.
terrible.
So her hemoglobin was at a 4 because of the fibroids?
Because of the fibroids.
Wow, that's scary.
And that's unbelievable. 6, 7 we see all the time. Women get iron transfusions. Women get blood transfusion. And nobody goes and checks why. Because women say, I don't want a hysterectomy. And nobody talks about UFE. 95% of women that come to us, they learn about uterine fibroid embolization from us. Not from gynecologists. And trust me, we've done the study. We checked top 100 university GYN departments. 100, about top 100. 95 had UFE listed as an option.
Wow.
And again, going back to head, right? If you, for headache, you list options. Do nothing, Tylenol, cold compress, or removal of the head. Like or. It seems like the same options.
Yeah.
For the head, we understand, or for the hand, we understand it's not the same. But for gynecological procedures, women don't understand.
Wow.
Don't understand the difference.
Well, I think
So-
they'll understand
So the key is
today.
education.
Yeah.
Key is education. Women need to be, any person need to be in charge of the body. If before, doctors were the biggest kind of storage of the medical knowledge,
Yeah.
today is not the same. You
No,
can
no.
put it on the internet.
Yeah.
Dr. Google will educate you a lot, and nothing wrong with it. Opposite. It's wonderful. And then people can just ask any question they want.
Mm-hmm.
That's how it should be.
Yeah. Well, I'm sure you answered a lot of questions today too, and hopefully we help somebody and give somebody some information who really needed it today. I always
hope
think
so
we
too.
put the information out. Hopefully, it lands to somebody who
Between
where they need it.
25 to 40 million women suffer from them.
Mm-hmm.
More than 10 very symptomatic. 1.2 million women have either myomectomy or hysterectomy. That majority of them, almost vast majority, could be avoided.
Wow.
Maybe 40, 50,000 women had the UFE procedure. You understand?
Mhm.
Drop in the bucket because nobody knows. So we need to do a lot of work.
Wow. We do need to. Well, you're
Well,
doing
we have
the work.
to start somewhere.
We're doing the work now. Well, thank you for today, and thank you for all
Angie.
such helpful information. And again, just if you could repeat where people can find you and find information.
It's usafibroidcenters.com,
Mhm.
usafibroidcenters.com. You can find plenty of information online. You can schedule, and we'll be very excited to help you and get you the best version of your life you can have.
Wonderful. Thank you so much for your
Thank
time,
you.
Doctor.